The drug, Narcan, will soon be available over the counter, potentially saving more lives. The FDA today approved selling the opioid reversing drug without a prescription. This is quite significant. Obviously, we are in the thick of an opioid epidemic as well. Let's talk about this even further. Friend of the program, Dr. Peter Chin Hong there at UCSF. He's been following this story today as well. Doctor, thanks so much for being with us. Did you see this coming? Is the FDA moving quite rapidly to get this done?
The FDA is moving quite rapidly, Andrew, and it's a real emergency in the United States. 1 million people have died in the last 2 decades, and these are people usually in the prime of their life. 100,000 deaths a year is no chump change.
Yeah, I was also kind of curious, how much is it going to be over the counter? How many generics, how many drug makers actually produce Narcan, and is it going to be affordable?
Well, I think that's the $1 million question, no pun intended. When you price it right now on some places in the East Coast, it's about $98, $78. So it's not really affordable for your average person. And sure, it might be covered by some payers, but I think, again, it reflects the patchwork landscape of how we pay for healthcare in the United States. And until that's really addressed, I think it's still going to be a lot of barriers for a lot of people.
Yeah, with the FDA's move today, Doctor, do you think this will, and is there maybe data to suggest that this will stem or mitigate the number of overdoses that we are seeing in the country, or at least help?
Yes, I mean, the idea is that it will help a lot. If you think about a couple of sobering statistics. First of all, about 50% of opioid deaths are witnessed. So if the idea is that if people were empowered and had agency to do something with something that was easily available, that will cut down on those number of needless deaths. The second reason or statistic is really interesting, which is that the FDA has been moving over time to try and liberalize the availability of Narcan through nasal spray, and they've empowered pharmacists to give Narcan without a physician's prescription. The second reason is, of course, cost. The type of formulation of Narcan that's cheaper is injectable, and that's harder to justify, I think, at this point, giving it over the counter. So price is really a barrier. I think that it was unwieldy. There were a lot of rules and regulations. Different parts of the country had different, barriers and willingness to sort of prescribe this to patients. So I think what this is trying to do is really put it in the hands of consumers, put it in the hands of family members and loved ones, so that they can be empowered to give this life-saving medicine if they have to.
Yeah, we've been speaking to some of our reporters just over the last several months that Narcan is now being made available on college campuses, in high schools as well. But, I wanted to get your opinion. Is there an apprehension? Is there a stigma now that this is going to be so public? Before this, and it is a life-saving drug, before this, you had the privacy of the doctor and the patient with whoever might need it with that prescription. Obviously, this can be more immediate now. But do you think there's going to be a stigma still?
I think there'll still be a lot of stigma. We know that there's stigma because only 15% of drug is currently given by pharmacists, and they were empowered to give this drug a long time ago by the FDA. And I think this move is meant to liberalize and decrease the stigma by having people access it in vending machines, at the gas station, in the supermarket, at Target. Of course, if the price point is too high, what's going to happen is that these drugs are still going to be locked behind the glass case or even in the pharmacy so that people don't shoplift it. And if that happens, then you still have to have that conversation. There's still going to be that stigma. And I hope we get to that point where, again, it's like giving an EpiPen if you have an allergic reaction. There shouldn't really be any stigma about this.
Yeah. So just lastly, because I think a lot of people want to know how this works. Medically speaking, you're saying it's like an EpiPen. It arrests the overdose while it's happening, correct?
Yeah, so it really blocks blocks the brain receptors or cells in the brain from taking up the drug, which can depress breathing, and people just basically arrest because they're not delivering oxygen to the cells. So by blocking these receptors, even if there's drug in the system, you're not going to allow it to enter the body and have that effect on breathing and the heart functions. I think the take-home away point about this is that, it may act for about 90 minutes, but if there's so much drug in the system, you may have to administer the second dose, and definitely call 911 because you may falsely believe that you've, reversed the situation.
All right, Dr. Peter Chin Hong, as always, we appreciate your insight, your advice on these top medical headlines, and we'll talk again.
Thanks so much, Andrew.